If you're somebody who is constantly dealing with knee pain, this could be the routine that changes everything for you. Now, I see tons of knee pain. It's probably one of the most common complaints that I get in my practice as a rehab-based chiropractor, knee pain and shoulder pain. And no two cases look identical when it comes to writing a rehab program. However, this specific routine program, whatever you want to call it, this group of exercises that I'm going to show you guys here in this video is the exact framework that I gave to my stubborn ass dad who has dealt with knee pain his entire life. He had some accidents when he was younger, falling off a ladder at work, dealt with multiple meniscus surgeries, had spent thousands on PRP injections, and after years and years of trying all of these different things, he still could not bodyweight squat to a box. My dad's always been very, very fit, and when I was living with them for a few months during my preceptorship before I graduated chiropractic school, me and him were at the gym at the same time, and he was telling me how he has this big goal of being able to squat 225 pounds again. And this is a guy who cannot even do a box squat, a body weight box squat. So him being stubborn, he didn't want me to write him a full routine. I said, listen, let me give you these simple exercises. Just throw these in every time you come to the gym. Even if you're not training lower body that day, do these exercises, do them a lot, and then let me know what happens over time. Well, too long didn't read. My dad is back to squatting under a barbell effortlessly. This is the routine that I gave him. The big caveat is because it worked for him does not mean it's gonna work for everybody. No two injuries are exactly the same. I think in general, this is a really, really good framework for you to apply into your normal program. So the first exercise that I gave him isn't necessarily an exercise, but more of like a mobilization, all right? And this is what we would call a McKenzie knee extension if you were a physical therapist or a chiropractor who's certified in McKenzie. In general, I tell people to get a baseline of where they're at, right? Can we squat? How low can we go before we start to get knee pain? What I want you to do is we're gonna bring one leg up nice and straight, and we're just going to flex the quad. You should feel a ton of tension come through the back of the knee. All right, if that's too much, then we're just gonna kind of slack it a little bit. We're gonna make a web with our hand. We're gonna go straight down, hyperextending the knee a slight bit just until we feel pressure, and then back off. We're gonna do that 10 to 15 times. Pressure on, pressure off. Pressure on, pressure off. Do that 15 times. Do it on the other knee if you have knee pain on the other side as well. Bam, bam. From there, we're gonna retest our box squat, right? We're gonna see, can we go lower? Can we get to the box without pain? Is there any change in symptoms? If we notice even the slightest bit of better range of motion or slightly less pain, that's good. We're gonna keep exploring those. That was number one. I said, just do these to start. That is gonna be movement number one, these hyper extensions of the knee. Next movement that we're going to do is going to be a split squat isometric. Range of motion is going to be just to where we can get into a pain-free bit of knee flexion, meaning how far can we bend the knee where it's still pain-free. What that's gonna look like for you dealing with knee pain, you're probably gonna have crappy motion at the hips and at the foot. So we're gonna stabilize on something. We're gonna come here, and all we're gonna do in this staggered stance is come down to a tolerable position. And from here, we're gonna hold. And we're gonna hold this isometric for a goal of 30 seconds. If you can't get there, try to take some load off by assisting or build up. Start with 15 seconds and do this until it gets easy enough to do a 30-second set. There's progression we can make from there, such as doing it loaded, doing it unassisted, but start with assisted split squat isometric with a goal of 30 seconds on each side. Build up to it if you need to, and that is the second exercise. The third exercise, super simple. Basically what I'm doing now, we're sitting to a box and we're gonna do box squats. When I first had my dad start doing these, we did them unloaded. Now this guy's a guy, he's very strong quads. There's lots of other movements that weren't problematic for him, but we started just body weight. Once we kind of established that the terminal knee extension exercise helped his knee pain, we just started loading it up. Knee extension mobilization, split squat isometrics, and then loaded box squats. The reason we're doing this is because we get a consistent level every time. So we know exactly where we're going and we can make the range of motion consistent set to set, week to week, and then increase the range of motion as we get better. For him, I actually had him start a little bit higher. We didn't even use like a bench. We didn't even go this low. We used probably a box similar to the one you can't even see it, but the one I have here with me, which is a little higher than a weight bench. So if you need to increase the height, increase the height. But for the purpose of this video, I'm just gonna show you here. So all we did was literally just a box squat. I had him go just until he starts to touch, back up. From there, all I had him do is we just grabbed a kettlebell and we started super light, like 10, 20 pounds, and started doing the same thing. The next week, we did the same thing, sets of 10 to 12, box squats with a weight. All he did, increase that kettlebell weight week by week. And next thing you know, he's like, why am I holding, a 90-pound kettlebell when I could just put a bar on my back. And that's how we got back to doing squats, slowly but surely. That is the framework that I used for my dad and a lot of patients as well, but that one means the most to me, so that's the one we're talking about in this video. If you have any questions, please comment, subscribe. Need any coaching help? Links down below for that.